everyone. My name is Kenya Springfield, and I'm honored to address you as a part of the Policy Advisor Project. Today, we confront a critical issue that touches every classroom, family, and community: mental health in our schools. At the heart of this discussion is the Every Student Succeeds Act, ESSA, a transformative education policy that redefines how schools support students' well-being alongside academic achievement. As educators, policymakers, and advocates, our collective responsibility is clear. We lift up one child's mind, we uplift the future for all. The Every Student Succeeds Act, signed into law in 2015, marked a paradigm shift in American education by emphasizing equity, school climate, and student well-being. ESSA mandates that states and districts monitor and report not only academic progress, but also school safety, climate, and student health, including mental health indicators. Across the nation, ESSA has empowered schools to invest in counseling services, mental health programs, and partnership with community organizations. In Florida, ESSA has been instrumental in shaping state policy. The Florida Department of Education now requires districts to submit annual reports on mental health initiatives, allocate funding for school-based mental health services, and implement training for staff to recognize early signs of distress. This has resulted in expanded access to counseling, increased collaboration with local health providers, and creation of peer support networks within the schools. Legal precedents strongly support the importance of mental health programs in school. One important case is Washington v. the U.S. Department of Education. Around June 2005, it was heard by Judge Kimberly Evanson, and it involved 16 states. These states challenged the federal government's decision to cut nearly $1 billion in funding from school-based mental health programs. Judge Evanson ruled that the grant cuts were arbitrary and capricious, recognizing how vital funding is for providing mental health support and professionals in schools. This outcome directly reflects my message of how important mental health awareness, support, education, and services are in our schools. Another important case was AJT versus Osseo Area Schools. It was decided by the 8th Circuit Court of Appeals and clarified a crucial aspect of disability rights in education. The court found that students with disabilities do not need to provide bad faith or gross misjudgment by the school in order to pursue claims under Section 504 of the Rehabilitation Act and the American with Disabilities Act. Instead, it is enough to show that the school failed to provide appropriate accommodations. This ruling lowers the barrier for students seeking justice and makes it easier for them to access mental health supports and other necessary services. The AJT decision supports the core of my message. Even though it is not directly related to my message, it supports it, and it reiterates how school must be proactive and vigilant in delivering mental health and disability related supports, and effective policies must not place undue burdens on the students who need help. Together, these cases, along with the ESSA and Florida statutes, create a strong legal foundation for mandatory mental health supports in schools. They demonstrate that providing mental health resources is not a legal requirement, but a vital step towards genuine inclusion and well-being for all students. Effective policy implementation depends on engagement of key stakeholders, and there are many stakeholders as it pertains to mental health in schools. First would be the students. In Hillsborough County, which is where I reside, students benefit from resources such as Hillsborough County Public Schools Student Services Department, which provides access to school counselors peer support programs like Sources of Strength, and student-led mental health clubs. These initiatives empower students to advocate for their own well-being and support peers. Another primary stakeholder would be the parents and the families, the caregivers of these students. HCPS also offers family engagement workshops, informational sessions on mental health, and partnerships with organizations such as NAMI, Hillsborough for Parent Support Groups. Families are encouraged to participate in school-based events and collaborate with counselors to identify needs and support interventions. Another stakeholder would be school administrators and educators. Administrators and staff can receive regular training through HCPS mental health training initiatives, which includes modules on identifying and responding to students' mental health needs. Professional development is provided in partnership with local experts and organizations such as the Crisis Center of Tampa Bay. Another stakeholder would be mental health professionals. Hillsborough County Schools employ licensed counselors, psychologists, and social workers. Washington v. the U.S. Department of Education was highlighting how they were trying to cut the funding for the services that are provided nationwide in schools and communities. The District of Hillsborough County collaborates with the Crisis Center of Tampa Bay and Tampa General Hospital for specialized assessment and intervention services. State and local education agencies are also important stakeholders. The Hillsborough County School Board and Florida Department of Education oversee funding and regulation of school-based mental health services, including annual reporting and compliance with ESSA requirements. Grants and state funding are allocated to expand access to students for counseling and support programs and services. Another stakeholder would be community organizations. Local organizations such as the Crisis Center of Tampa Bay, NAMI Hillsborough, and also the Healthy Start Coalition partners with schools to provide outreach, workshops, and referral services for families and students. And last but not least, policymakers. The Hillsborough County School Board, local government officials, and state legislators drive legislative change and allocate funding for school-based mental health initiatives, insurance compliance with state and federal mandates. Now, I've identified all of the stakeholders. Now, I'm going to speak on how I can partner with these resources and how we can utilize these resources to better benefit the schools to be able to support mental health services within the schools. I will reach out to the Hillsborough County Public Schools Student Services to join the advisory committee and collaborate on pilot programs. I can engage with NAMI Hillsborough and the Crisis Center of Tampa Bay to co-host parent workshops and awareness campaigns. I can also work with school administrators to develop and evaluate school-based mental health training modules. I can also coordinate with Tampa General Hospital and Healthy Start Coalition for enhanced referral systems and specialized support. I can participate in policy forums organized by the School Board of Florida Department of Education to advocate for legislative changes and increase funding. I can build formal partnerships with local community organizations for resource sharing, outreach, and advocacy. By actively collaborating with these stakeholders, I can help shape policies, enact new laws, and bolster resources for mental health support in schools, ensuring that the needs of students and families are met with evidence-based, accessible programs. I also think that some policy recommendations that I have is that mandating annual mental health screening for all students with parent consent and privacy safeguards. Increase funding for school-based mental health professionals to meet recommended student to counselor ratios. Integrate social emotional learning curricula across all grade levels. Establish statewide data systems for tracking student mental health outcomes and interventions. Establish statewide data systems for tracking students' mental health outcomes and interventions. Provide ongoing professional development for educators and staff on trauma-informed care and crisis intervention. Expand partnership with community health agencies for wraparound services so that mental health services can stretch beyond the school walls. And also include the student voice in policy development through advisory council and feedback mechanisms. Now, as with anything, there are many opposing arguments, but for every opposing argument, there's a rebuttal. A lot of people would say that mandatory health support may infringe on parental rights and student privacy. But policies can incorporate consent protocols, confidentiality safeguards, and opt-out provisions for families that aren't interested, balancing individual rights with the collective benefit of early intervention. Another opposing argument would be the increased costs may strain schools' budgets. It is very costly to provide these services, to have licensed professionals and these supports in the school. But research shows that investment in mental health reduces absenteeism and disciplinary costs, which offsets expenditures and improving academic outcomes. Federal and state grants, as provided by ESSA, can mitigate financial challenges. Another opposing arguments would be that schools lack the capacity to implement comprehensive mental health programs, which goes back to the funding. With the funding, there are so many things that could be implemented into the schools. Strategic partnership with local agencies and phased implementation allows schools to build capacity gradually, ensuring sustainability and also effectiveness. Now, my call to action is, and the overall goal should be, to establish mandatory, equitable, and effective mental health supports in all schools, ensuring student well-being and academic success. Engage stakeholders, students, families, educators, and all of the different stakeholders that I mentioned previously. Lobby for legislative changes at the state and federal levels to mandate and fund school-based mental health services. Launch pilot programs in high-need districts and evaluate outcomes for scalability. Develop public awareness campaigns to destigmatize mental health and provide and promote available resources. Implement ongoing evaluation and refinement of programs based on data and stakeholder feedback to be sure that everything is effective and appropriate. Let us stand together for youth well-being, for a promise of mental health awareness, and for the future of education. By acting now, we can transform silent struggles into shared strength and lay foundation for resilient, thriving communities. Together, we can turn silent struggles into shared strength.